trash bags and ponchos for protection.
It's a real tragedy.
Some nursing home workers in California donning makeshift PPE as they battle the coronavirus on the front line.
Many are afraid of contracting the virus themselves. We want to see more N95 masks. We want to see more isolation gowns.
April Verrett is the president of California's largest union. They represent a quarter of all nursing home workers in the state who face staggering new statistics.
Well, we're putting out the numbers in detail today. Over 3,500 people tested positive within that system. We have roughly 400 facilities where we have either a staff or we have someone we're caring for that has tested positive.
That's at least 12% of all coronavirus cases statewide.
So your death rates are now at the highest they've been, and the number of people in the most vulnerable settings are seniors.
One recent outbreak in Woodland at St. John's Retirement Village. Family members say dozens are sick, staff and patients, and one person has died. Yolo County health officials will not comment on the location, saying they're protecting people's identities and that all families with a sick relative have been notified. That's the same policy in Placer and Sacramento counties, confidentiality.
When you weigh the two things, I think the policy really has to be towards the safety of the public. I was very distressed to hear that there were some nursing home staff who did not know that they had COVID positive residents in their nursing home. And I think that is incredibly unfair and dangerous.
I asked Governor Gavin Newsom about this today.
Could you please explain for those who are growing frustrated, why don't facilities and county health departments have to release specific updates related to COVID outbreaks? For example, identifying the facilities, especially at a time when information is so vital.
I'm with you, and you will be receiving by site that information, and we will continue to try to update it, make it more granular. We have a HIPAA and patient privacy concerns, so it may not be everything everybody wants, but it is a substantial leap forward in providing you that information that you correctly deserve.
I appreciate the concern around HIPAA. I don't think we need to release names, but I do think we should know as a general public, family members are deeply concerned about their loved ones that are in nursing homes.
Data that nursing home workers say won't just shed light, but help save lives. In Sacramento, Marlene Martinez, KCRA 3 News.